With what though?
Like you can record now and you can still like
Did it start?
yeah, it's recording.
Oh,
But you should like make this full screen and stuff.
okay, okay,
Yeah, now you can start.
okay. Um, wait, there we go. Okay. We're going to talk about the effect of Medicaid expansion on employment status. I'm Nathan.
I'm Lily.
So today I'll give you just an overview. Um, Beginning with the Affordable Care Act. This originally started in 2011, but the expansion took place in 2014. We're going to be talking about the expansion today. So, with the Medicaid expansion taking place, this basically provided more people with care in an affordable way. In the past, insurance companies would choose to provide who they wanted to give care to, and this is not the problem in this case. Looking at poverty levels, California enabled adults with incomes up to 138% of the poverty level to have access to Medicaid, being effective in 2014. And why we chose this topic. Lily and I are both from California. We both live in different areas of the state and are curious as to how this is such a prevalent issue and how it relates to employment status and poverty levels taking place. So, talking about our models and methods, we're going to be using a difference in differences model to look at panel data. And I'll break down this equation and talk about all the different variables more specifically. But yeah, so beginning with YIST, our outcome variable, this is indicating employment status. So I is going to talk about the individual, S is going to talk about state, and then year is going to be represented by T. And then within this, we're going to be having 1 and 0 representing employed and not employed. Our treatment variables are going to be California, CA, and this is whether or not the individual resides in California. And this is going to be indicated by 1 being the expansion state and 0 representing Texas, which is one of the states that did not adopt the expansion, so they're non-expansion state. Post T, this is going to be represented by the years after 2014 and pre-period years. So it's going to be grouped as 1 and 0 representing 2012, 2013, and then 2015, 2016. Then we have our interaction term. This is where we're going to show the causal effect of Medicaid expansion taking place. So this is going to be the connection between whether the individual resides in California or not, and then whether it's the years before or after the expansion taking place. Then XIST is going to be represented for changes over time and between states. I'll also talk about the control variables we have, and then we also have our error term, which is also represented with individual state and year. So our control variables here, we're going to have age, sex, race, marital status, education, household income, number of children, citizenship status, health insurance coverage type, and disability measures. Now within this, we also know we have the beta 3. So with this is going to be measuring the change in employment status in California taking place, being compared to Texas after the expansion of Medicaid taking place. Um, then
We chose to use panel data, and this allowed us to survey 5 years of the same population. And we divided this data into 4 groups, and we named them pre-control, pre-treatment, post-control, and post-treatment. And these groups were created to compare both states and times. So we're doing California and Texas before and after 2014. As we said, our outcome variable is employment status, and we defined adults as ages 25 to 64. Um, in our results table, we can see that the coefficient on the treatment and post interaction term was only 0.92 percentage points, and this is not statistically significant based on the control group. And this tells us that other demographic variables are involved, such as age, sex, disability, and healthcare coverage status.
So concluding here, what we learned from the topic so far is that there were other variables that were more focused on a demographic status rather than just the policy change and implementation taking place. This tells us that the data was not significant in terms of looking at the interaction term, which is the main variable we are focused on.
Some challenges we had with this topic was deciding what exactly would be the variables affecting the employment status outcome and being able to differentiate them from one another. Another challenge was finding a panel data set that would fit our topic in the years that would fit within the policy change.
Looking forward, it would be really interesting to conduct this expansion on other outcomes that could relate to chances of families having children and even how policy changes impact adults' decision making within their families. Thank you.